Many mothers are wondering what they can do to help induce labor naturally. And of course, you get to the end of pregnancy and you're desperate to do whatever it takes to get that baby out because you're so uncomfortable and you just can't wait to meet them. But it's a fact that babies do best if they're born after 39 weeks. They eat better, they grow better, they breathe better, and they're more likely to do well overall. So until 39 weeks, just let nature take its course and try to hang in there and be patient. But once 39 weeks comes, there are some things that you could do to potentiate contractions if they start. Now, your body should, up to weeks to days before you actually go into labor, do some prep work where your body's releasing hormones called prostaglandins that act on the cervix and cause it to soften, move forward in your pelvis, and thin out. And then when you do start having contractions, those contractions were caused by a hormone that was released from your brain called oxytocin. It acts on your uterus and tells you to contract. So you may have irregular contractions in the beginning that slowly work up to regular contractions. Once you start to have regular contractions in your 39 weeks or beyond, move around. Do what you can to potentiate them, because when people aren't full term yet, we tell them to lay down because that can help contractions go away. So the reverse is true. If you're full term and wanting to have a baby, move around, clean your house, go for a walk and be active, and maybe it will make those contractions get worse. Now, a good test is if you're moving around and then you sit down and they stop, it's not time yet, it's not real labor. So try that if you get to that point. In addition to moving around, one thing that you can try if you're past 39 weeks is do the same thing that got you into this situation in the first place, if you know what I mean. Sometimes intercourse can stir things up, and afterwards, if you're contracting, then get up and move around. And again, these contractions may become regular and intense, which then leads to your cervix dilating, which is the true definition of labor. As for herbal supplements or things you can eat or take to induce labor, it's best to avoid those types of things because there isn't any clinical data that shows that eating or taking anything is effective, and in some cases it can be harmful. I've heard everything from pineapple to mango to watermelon and eggplant and spicy food, and even walking on a curb and pretending like it's a balance beam. I'm not sure how that would help, but I've heard just about everything, including castor oil. And especially in the case of castor oil, it is not safe. So don't take it, even though your friends might tell you that it will induce labor. It certainly might, but it can be harmful to you and your baby and should be avoided at all costs. In fact, induction of labor is best left up to healthcare professionals. There may come a time in your pregnancy when your doctor decides that for your well-being or the well-being of your baby, you need to deliver. And do know that your ultimate due date is 41 weeks. So if you're still pregnant on that day, your doctor will plan on an induction because placentas have an expiration date and they don't feed your baby as well at that point. So that's your ultimate due date, and that's what you should put in your head so you don't get too discouraged if you go past 40 weeks. Of course, there are many other reasons for medical induction, but in some cases, doctors will also offer an elective induction, where at 39 weeks, because babies have been proven to do well at that point, the doctor allows you to come to the hospital if your cervix has done all that prep work and is favorable and ready for labor, and we start oxytocin or Pitocin instead of having your brain give it to you. We give it to you through the IV, and you start to have regular contractions, which then in turn cause your cervix to dilate and open up so that the baby can come through and be born. And when done under the right circumstances, the risks of induction are low. And it's nice for some parents who've already had a baby before because you can get a babysitter and dad can get work off. So this is a good option for many women as long as the doctor feels like you're doing it under the right circumstances. If you have any more specific questions about your situation, don't hesitate to talk with your OB provider, and they can shed light on what's going to be best for you and your baby and what you can look forward to. But if you have any other questions in the future for me, feel free to ask them on our Facebook page at facebook.com/InnerMountainMoms, and recommend us to your friends and family too.